Hi, I'm Dr. Matt Sheehan, and I'm a chiropractor practicing in Medford, Oregon at Medford Family Chiropractic Center. And today is Monday, January 13th, 2020, in case you're wondering when this is being filmed. And today I am in Ashland, Oregon, with a friend of mine, Dr. Chris Lebowski, who is a wonderful chiropractor, and he's also a naturopath, which is a wonderful combination, as you'll soon hear. And so today I'm wanting to ask Dr. Chris about primarily something that I heard he has been doing for a number of years that I in the vernacular, I term it intravenous or IV vitamin mineral cocktails. And the reason I'm interested in that is because personally, as a chiropractor, I've been prescribing magnesium to my patients largely for muscle issues when they come in with strains and sprains and torn or spasm muscles. I like to recommend it for those issues. And when I heard that Chris was doing intravenous versions of that, mixed with other minerals and other vitamins, I became intrigued. So I wanted to come and go right to the source and ask him why he uses it and what the results are, the upside, the downside, and all things in between. So with no further ado, Dr. Chris. Thanks so much, Chris, for having me come in
Good
today.
to see you. So I got into using intravenous medicines mostly because, as I'm sure you see in your patient base too, most of our patients don't have the healthiest gastrointestinal tracts when they come in to see us. I'm sure you would agree.
Right.
For one reason or another, either they have some sort of chronic disease, they have stress, they've beat up their gastrointestinal tracts with bad dietary habits over the years, and their absorption levels for anything they take in goes down dramatically. So I found in my very sick people who have cancer and Lyme disease, other chronic infections, toxicities, that we weren't getting enough oral absorption taking supplements in that way. So we added an IV suite in the office where we have a nurse here on staff every day who delivers these vitamin and mineral cocktails so we can get those people well again. Because just like you, my fascination and interest is helping people that are very sick move through a disease process and get better. By delivering it intravenously, you get 100% absorption. They estimate that if we take magnesium orally in a healthy gastrointestinal tract, it might be something like 30 to 40% absorption.
Wow, huge difference.
It's a big difference. It's a really big difference. And we notice that in our patient base. The people that get IV mineral and vitamin cocktails do so much better and get better so much quicker than the people that don't.
When you use oral magnesium by contrast, do you sometimes start people on oral and then see how they do and then move to the IV if you need to? Or
Sure.
do some people, you just put them right on the IV right away?
Sure. It depends on the patient's tolerance for it. If we have a pediatric case, we don't do that many IVs for kids because kids don't like getting
Right.
IVs.
Yeah.
Or sometimes you have someone that's so sick that their venous structure, it's impossible to even get an IV in. So we'll start them on oral. Or when people finish IV mineral repletions, then we'll move them into an oral supplementation program.
Right. Okay.
A lot of people, we do both at the same time. People that are really magnesium deficient, the people that are under lots of stress, the people that have cardiac conditions, the people that have chronic infections, people that are really tired or chronic fatigue patients. Those people would be getting IVs 1 to 3 times a week and then also taking oral supplementation too. And magnesium is, you need it for 300 different enzymatic reactions in the body. It's we find most of the stuff in the muscular tissue. About 75% of our magnesium is contained in our bones, 25% of it's in our muscles, and in the muscles it's actually in the mitochondria.
And the mitochondria do?
The mitochondria are the very interesting organelles we have inside our cells that create our energy.
Powerhouse of the cell.
Powerhouse of the cell.
Yeah.
So you can see the relationship between magnesium and energy. How many of your patients are tired?
The vast majority.
Most.
Come in exhausted. Yes.
They come in exhausted.
And that you also said something earlier that sparked my interest. I've heard that magnesium, in certain instances, is really helpful for stress, anxiety. Anxiety being separate from stress, obviously, in certain cases.
Sure.
But what can you tell us about your experience with that, with stress or anxiety?
Sure. I mean, everybody that's going through a chronic disease process has some degree of stress. Often stress is what got them into that in the first place. And then lots of our patients have anxiety too. And just like we've seen with people in the middle of a migraine headache or an asthma attack getting some intravenous magnesium, people in the middle of an anxiety attack or an anxiety stretch will feel dramatically better getting some intravenous magnesium. Makes a huge difference. And those conditions deplete magnesium. So it's this vicious cycle that if you're stressed and you don't feel well, you have less magnesium overall. You know, the other things that really deplete magnesium, alcohol depletes it. A lot of medications do too. Anybody that's taken antibiotics, oral contraceptives, steroids, diuretics, they all deplete magnesium.
And so many of us are taking those.
Exactly.
So many of the people coming in our doors are taking those.
Absolutely.
Wow. Okay, well that's great. As I just asked Chris before we started if he had a handout for me that I could utilize with both with my patients and for me just to jog my memory about when it would be appropriate to recommend his either magnesium by itself orally or definitely his IV vitamin mineral cocktail approach. So
when I get done, I'm going to make a handout.
There you go. Yeah. There you go. I'm going to hold him to it. Yeah. And now, it just dawned on me, we've been focusing on magnesium because that was one of my interests.
Sure.
But also, I'm wondering what else is in the bags with the magnesium.
Absolutely. So when we create a formula around stress, or let's say we're making a formula that's the major mineral in there is magnesium. It's going to have other things in there too to balance it. Typically it will have some B vitamins in different ratios, almost always some vitamin C, maybe some zinc, certainly some calcium. So they're nice blended formulas and not just pushing on one area of the physiology. And then, you know, in almost every IV we give, whether these are high-dose IV vitamin C or we're giving a formula around macular degeneration, they almost always have magnesium in them too. There's very few formulas that don't have some magnesium because it's such a balancing cation. You need it for so many reactions that the bags won't be nearly as effective if they don't have magnesium in them. So we go through tons and tons of magnesium.
I see.
Yeah.
So it sounds like from what you're saying also there's a vast array of not only conditions that you're treating with this one modality, but also a real big variety of elements that you'll include in the bags, depending on what the condition is. It's not just a magnesium thing.
No.
It could be heavy in B vitamins.
Absolutely.
It could be heavy in other minerals and other vitamins, such as vitamin C.
And every single person gets a different bag too. Every single thing we do here is completely tailored to the patient. So no two patients get the exact same thing because you may need a little extra B6 and this person may need a little extra B12 and that person might need a little extra zinc. And so every bag is tailored to that person.
Okay, all right. The handouts are starting to rack up now because my head is spinning. Right, I'm gonna need like that.
That's
right?
okay. I'll write
hand
you
up
a
for
little
that.
book.
Hand up for that. Right, a little book. Right, Chris's book. We'll call it. Here we are in Chris's IV suite, as that's just my term for it. I don't know what you
That's what we call it.
Yeah. IV suite. There we go. So this is where Chris would have his nurse implement the intravenous bag, run it, slow drip into the arm, and people would be sitting here 1, 2, 3 abreast, so to speak. And Chris, how long does it typically take?
It depends on the bag, usually at a minimum 45 minutes, and then if you're getting a really big bag of something, upwards of 2 hours. But I would say the average one is about an hour.
Okay, all right, that's
so
great.
People can pop in the middle of the day, get a magnesium push, which is a quicker one, or a bag if we're treating some stress, or if it's part of their bigger treatment plan, because they need to come a couple times a week, usually about an hour.
Are there payment plans or like discounts if people buy a certain number of them knowing they're going to do it for 6 months or something
Absolutely.
like that?
We work with people like that. People that are in a big treatment plan, we certainly look at the big picture and try and make it affordable for them.
Oh, that's great.
Yep.
And I'm wondering, someone had mentioned to me earlier today that they're scared of needles and they've had some bad experiences with phlebotomists or getting their blood drawn. So I'm sure some people watching this are going to be like, oh man, there's no way I'm letting somebody stick a needle in my arm. What's been your experience with that?
Sure. That's a very real phobia for a lot of people. So in our office, we hire a nurse, an RN to do it who has a lot of experience with not only drawing blood, but inserting catheters into people's arms. Because at the end of the day, that's the most important thing. So we only hire RNs, we only hire ones with lots of experience, and we find that most people who are sort of gun shy around needles, after they come in here, they lose their phobia because they have such a good experience. As you can see, it's a really relaxing environment. The tone is quite mellow in here.
Yeah.
People can recline in these chairs, put their earbuds in, watch a movie, read a book, whatever they need to do to sort of calm themselves. And most people end up having a great experience with it.
That sounds great. And I'm remembering now, I had this experience here about maybe a year and a half
that's
ago,
right.
and as an introduction, and it was really pleasant. It was very easy. The woman was so nice and so sweet and so professional, and got it done. And it didn't hurt at all. I was just sitting there, just relaxing for about 45 minutes to an hour, and it was easy. And you also, I noticed, have some wonderful books. Yep. Sitting here for people to become acquainted.
We rotate them out for different people to read. Yeah, it's a little poke. It feels like getting your blood drawn. Once the needle's in, you really don't perceive any pain at all. If it's a slight bit painful, usually we just slow the drip down a little bit, and then you don't even notice anything. The time
great.
goes by pretty fast. If people need to get up and use the bathroom, they've got a rolling IV pole. They can roll into the bathroom there, go pee, come back out, finish their IV, so you're not stuck in the chair for the whole hour. We bring people tea. We have snacks here. We make it a really pleasurable experience.
That's great.
Yeah.
That's awesome. That's wonderful. Okay, you know what else I'm interested in seeing about your place now that I look around? I'm thinking it would be wonderful to be able to, if you have the time, to show people some of your other equipment, things you utilize in your practice that you think are the most beneficial, that you have the most best results.
I'd love to. Let's do it.
Great. So now we are standing in Chris's hyperbaric chamber room, and I've just exhausted my entire wealth of knowledge about hyperbaric in that one statement. I know nothing about it, and I'm going to turn it over to Chris to tell us about this nifty equipment.
So the hyperbaric chamber, you can see here, is it's about body length. And when it's inflated, it gets about this large. People climb into it. It's very comfortable in there. The reason I have a hyperbaric chamber mat is I bought it initially for all my patients who have chronic infections and cancer. Once I started using it in those people, I realized that it has much greater application in that. So in the people with chronic infections, as you know, a lot of infections don't like oxygen.
Yeah, and can I stop you one
Please.
second? I'm just curious. I'm thinking that the term hyperbaric might be confusing for people. I'm wondering if you could start with how do you define hyperbaric?
Sure. So whether it's a soft chamber or a hard chamber or a room where the person is placed in that area and then the amount of pressure is increased.
Okay.
So, like barometer, baric.
I see.
The original applications for these were used in divers. People that went in the ocean and then they got the bends from coming up out of the ocean too fast, they would put them in hyperbaric chambers. So they had these on boats, they used them with Navy SEALs, they used them in the military. And then people in medicine started to realize there was a lot of really great applications for hyperbaric medicine.
Okay.
So we were finding really great results in all the people with chronic infections. People with cancer do really well with hyperbaric also because cancer cells, tumors create this local area of hypoxia. So by forcing oxygen into those tissues, you actually make it a less conducive environment for the tumors to grow, and you help all the other metabolic state of the patient to get them well from the cancer.
So it sounds like you're saying if in a cancerous state, cancer cells grow well with less oxygen, so the more oxygen we can pump into the area, the more it's going to inhibit the growth of a tumor cell. Is that accurate?
Correct. And it's going to help the entire patient be well, which is how we get people well from cancer, right? We treat the entire body,
right,
not just the local tumor.
Okay.
So we were doing that for a while, and then we started putting all the autistic kids in here also, and they were getting their speech back, behaving better at home. Wow. I know, it's amazing.
Really?
Yes,
really?
absolutely.
Wow. And so what have your results been with cancer? What can you tell us about experiences with it? Does it seem, if you're doing so many things with a cancer patient, I imagine it would be really hard to say, well, this did that,
sure,
and that did that. It's probably, I imagine, the whole result.
It always is.
Yes.
No one therapy is the answer.
Yeah.
And so that's why we do so many things here at Ashland Natural Medicine, because no one's going to come in and just have hyperbaric oxygen for their cancer. It's a part of a treatment plan, just like anything else. So yes, it's hard to tease apart sometimes the role of it, but in chronic disease like you see with your patients, you have to do lots of things.
Yeah.
People are more toxic these days than they've ever been. People are more stressed. They need more therapy. So we like to have lots of different tools, as you do too, to grab from and say, these are the specific things you need. And as we always say here, no two people get the exact same treatment plan.
Yeah.
The hyperbaric chamber is also critical in people that have had head injuries, any of your head trauma cases, people that fall off their bicycle and hit their head, people who have ski accidents, people with memory loss from brain trauma. We've seen amazing things with this.
Wow, so concussions. And
Oh,
things,
absolutely.
Athletes.
All the time, all
Car
day
accidents. Wow.
Yes.
Okay. All right, well, that's fascinating.
Helps tissues heal.
Wow. See, that one thing alone makes it all worth it for me to come and interview. Not that I needed any other reason to come, but that thing is that one aspect is huge, because I'll send you 5 people a week.
Yeah, it's a really important therapy. We love having this thing.
Oh, that's great.
Oh, yeah.
I'm curious, how do the autistic individuals, is it difficult getting them used to it so they're willing to get in and things like that? Is that a challenge?
Sure, usually the first time or two. The great thing about this chamber, and it looks small now, when it's inflated it's quite large, so the parent almost always goes in there with them.
Oh, okay.
And then I would say, I can't think of an autistic child who didn't end up liking going in there after a little while.
Yeah.
And you can bring an iPad in there, you can bring a computer, so most of them
Okay.
watch movies.
Okay.
They're in there for about an hour. It's really comfortable, and most kids get a kick out of it. Every time my kids come to the office, the first place they go is to try and climb in the chamber. It's an attractive nuisance in the clinic for little kids.
Right,
They like to
exactly.
get in it. So
Right.
we've had 2 adults in there at a time. You can lay, foot to foot.
Nice.
It's really quite spacious and comfortable. Most people that are claustrophobic end up realizing that it's not a problem.
Oh,
Every
that's
once in a
great.
while we'll have someone who can't do the hyperbaric, and we pick some other therapy.
Well, there we have it. So here we are in Chris Lebowski's apothecary or medicinary. You can use either term. And we wanted to show you this absolutely awesome room. Well, I'll let Chris explain one of his pride and joys, what he likes people to know about this wonderful room.
I would say it's my favorite room in the clinic. So what we do in here is we mix custom tinctures of different herbs for people, because everybody gets a different formula, right? One person's anxiety is different than someone else's anxiety. So Dr. Miki and I pick the herbs that fit that patient's constitution as well as their particular complaints. So we spend a lot of time in here deciding what herbs people are going to get. We also have a whole bunch of different supplements, including magnesium on the shelf for different conditions. So in this room, we can pretty much treat everything that walks into the clinic. We have a huge case full of homeopathics over here also. And I just really like this room because I think it shows how different every single person's treatment plan is. One person will get a tincture and a supplement and some IVs. Another person will get a homeopathic, some hyperbaric, and some acupuncture. Everybody's is different.
That's fantastic. Do you do acupuncture yourself?
I don't, but Dr. Miki, our other naturopath, does. She's a
That's great.
naturopath and an acupuncturist.
Oh, wow. So chiropractic, acupuncture, and naturopathy.
The trifecta.
All in one office. Wow, that is wonderful. That's great. Well, sometime we'll have to talk about all that aspect as well.
Great. Sounds good.
That sounds wonderful. And I'm just curious, are there any particular ways that you recommend magnesium in particular to your clients, when your patients, when you are recommending it for them orally, or is that really vary depending on the patient also?
Well, you have a bunch of different forms of magnesium, and so depending upon the condition you're trying to treat, we use one of the different chelates of magnesium.
And
so,
chelation means?
That it's bound to another molecule.
To make it more absorbable.
Exactly.
Got it.
Chelate is Latin for claw. So, for example, if you have someone that has constipation and they have muscle spasm, you might use a citrate. You might use like a magnesium citrate.
Okay.
If you have someone that has lots of anxiety and muscle spasm, you might use something like a magnesium threonate, where that gets more blood-brain barrier absorption. So it just depends on the condition, like anything else.
That's great. Great to know. And I'm sure that is the same for all this stuff. You must have a vast memory.
Well, I spend a lot of time in here and I think about it a lot.
Yeah, that's wonderful. That's great. So, thank you for exploring the apothecary with us.